we going to do to educate the workforce of the future for the better? Now, one of the things that falls within my remit at Anglia Ruskin University is the development of curricula. But certainly don't tell my children this, but sadly, I don't know everything. Don't tell them. So what we need is to work in partnership with all of you so that we can learn what we need to know, so that we know what we need to educate the staff, workforce of the future. And that's everything from registered nurses to consultants, to our service users and our volunteer groups, and our unregistered, unqualified, if you want for a better word, professionals that we work with. We all have a huge part to play when it comes to looking after the well-being of our patients, and that's both physical and mental. You'll be probably sad to know that I'm one of those people that has no mental health training whatsoever. I qualified as an adult nurse with Florence Nightingale a long time ago, and what I knew then about mental health you could probably put on the back of a postage stamp, and everything I've learnt since has been through informal and unofficial training. Even to this day, a general nurse, or an adult nurse as they are now called, I have to be field specific from the start, and under the EU regulations the only requirements is that they have a little 6 to 8 week insight training in mental health issues. Probably not adequate, but what we're doing at Anglia Ruskin University, with your help and with everybody else's help, other universities are also doing this work, so I can't say it's just us, is we are implementing best practice that you share with us from ideas such as the Promise and all the other ideas. We're looking at what the World Health Organization has to say about mental health awareness, and we're implementing it into our curriculum. So we want to develop a positive and proactive workforce for the future. We heard somebody else today say something about, it's not me. We don't want to do that. We want everybody to be enthused and encouraged about all aspects of health. And one of the things that we're going to be doing in our curriculum, and that we have already started to do, is to integrate service user involvement right from day one. So we have a values-based recruitment that starts with using service users from all backgrounds, including those with mental health problems, in our actual interview process. We actually, just coincidentally, have a values-based recruitment process for the staff that work at the university as well. And in that value-based recruitment programme, we look at scenario-based recruitment, we look at mental health issues for somebody that's got physical health as well, so that we ensure that those people coming into the workforce know that it's not just about mending that broken leg or giving out that medicine. There are wider issues at stake, especially with an ageing population. We know we're getting more and more people coming into hospitals who have also got comorbidities alongside their physical health. They've got their mental health issues as well. We have implemented recently into our undergraduate training programme a buddy scheme system, which was a pilot with one of our Essex Trust community partners, where we invited mental health service users to come alongside our senior year student nurses to share their experiences and to live that process with them. This was evaluated so successfully that we have been asked to roll it out to the Cambridgeshire side of our courses, and hopefully up to our Peterborough. So when you consider we are in the East Anglia bump, and we have campuses in Peterborough, Cambridge and Chelmsford. We run right up that M11 corridor, really verging onto London. We're hoping to be able to reach a whole vast of service users out there that can help us. We didn't do this by ourselves, we did it in partnership with one of our community trusts, and I suspect that you'll be getting contacts from the university team to talk about developing this in the future. So getting service users involved in a way that helps the students understand what it is that exactly they need. Because who's the best person to tell us? I presume they are. Sometimes they don't know what they need, but just hearing their stories and working alongside them gives them the opportunity to do that. The other thing that we are doing in our new hopefully to be revalidated on the 16th of December, pre-registration nursing curriculum, is introduce some modules on leadership, which incorporate scenario-based workshops that include service users as well, so that we get them to do communication strands and de-escalation skills, even with our general nurses, our adult nurses, because de-escalation skills is not a strength of an adult trained nurse, so it's something we're going to start implementing from day one and carry all the way through as a strand, all the way through the 3 years of training. Now that's great, that helps us with our pre-registration nurses, but what about the workforce that's already out there? The workforce that's already qualified, the workforce that's been doing it this way for so long that it's difficult for anything else to happen. So this is where obviously post-registration training comes in. We have developed, alongside our mental health team, we have developed some schemes. We've got a buddy scheme, and the Vera scheme is the words I was trying to look at, which is a communication tool to help de-escalate difficult situations. We've also taken this on board in as fact as these are all aimed at qualified members of staff, but like I said at the beginning, there are plenty of volunteer organisations out there, unqualified members of staff, people that aren't necessarily on a professional register that actually have input into the well-being of these people. So we are developing a couple of undergraduate and postgraduate courses that you don't necessarily have to be a registered practitioner to come onto. We're doing a master's in mental health or an undergraduate degree in health and well-being. But not everybody wants to do a master's or a degree, do they? You know, and also money's tight. So we're also developing workshops, bespoke workshops, working with trusts and organisations. What is it that you need your staff to know? We'll come in, we'll develop those workshops, and we will help them to become the practitioners that your service needs, because every service is different. Without your help, however, we don't know what it is that you need, so that partnership working, which this Promise charter has started, the snowball effect. It's getting bigger and bigger, that everybody's clambering board to get involved because of how useful it's going to be, is only going to help us take this forward. Now, I'm down at Parliament on Monday with the Million Plus Group, which is a think tank lobby, and we will be discussing how we can put forward all the proposals from the Promise project to lobby Parliament to ensure that we can get a better workforce for the future. And Julie has just a couple of things to add.
Well, my job's going to be to work very closely with the Promise project to look at what sort of training needs specifically they would like from us. So that's going to be my role. Whether that's in-house training, so we come in and work with you, actually at the hospital, whether it's courses you need or one-to-one workshop, half-day workshops. We're also in the process at the moment of developing online workshops where people can actually access the information they need online as well. So I'll be working very closely with Manan. And I think that's it.
Excellent. We've gone under our 10 minutes, so we'll try and go now. Thank you very much.